During National Minority Health Month, a national group aims to increase awareness and spark action to address the high mortality rate of Black mothers in the U.S.
The Black Mamas Matter Alliance just wrapped the second annual Black Maternal Health Week.
Here in our state, a 2018 report revealed Black women were 50% more likely than other women to suffer a pregnancy-related death, a statistic that put some Central Texas mothers on edge during their pregnancy journey.
So cute.
Next month, Alex Price will celebrate the birthday of her first daughter, Marley.
She is a firecracker. She's her daddy's best friend. She's super smart.
The 31-year-old recalls being emotional when she welcomed her daughter into the world 2 years ago.
It was just overwhelming, like love and joy and relief.
Price had an unplanned C-section.
The heart rate dipped and it stayed down for a while.
Marley was born healthy, but Price had lingering concerns about her hospital experience.
I didn't really feel listened to. I felt like I was getting good care. I just didn't feel like what I requested was honored.
The Black Mamas Matter Alliance says other Black mothers share the same sentiment.
I think if people are aware of it, they can take more of a stand to outright make a difference about it.
The organization that founded Black Maternal Health Week aims to improve maternal health, rights, and justice for Black mothers, a group of women who are at a higher risk of dying from pregnancy-related causes. A statistic that worried Price and another Waco mom during pregnancy.
And it's scary.
Baylor Scott and White nurse manager for labor and delivery Candace Bolton says racial disparities and health conditions during pregnancy can be contributing factors.
So they have probably a chronic condition, whether it's hypertension or diabetes or some other kind of health problem.
And she says her hospital is working to be part of the solution, joining a state initiative to prevent and respond to pregnancy complications.
Some of them are risk assessments. Some of them are really looking at our policies that we have in place. And it's really about trying to be more proactive instead of reactive.
As part of the Texas AIM initiative, Baylor Scott and White and other hospitals in the state are addressing maternal hemorrhage, opioid use, and high blood pressure.
Those are the top 3 most common causes of death the state identified from data analysis from 2012 to 2015. A research project of University of Texas Austin is looking at ways to eliminate maternal health disparities in Travis County. Associate Professor of Social Work Dr. Michelle Roundtree says as a part of the community-based approach, they started home visiting services and support circles for Black mothers. They are analyzing the impact of those measures and tracking data of moms meeting delivery dates and baby birth weights. She says even though the preliminary data is favorable, institutional racism still remains a contributing factor that needs to be addressed.
What we're finding is that moms are indicating that they're not feeling as though the healthcare institutions are responsive to their needs or listening to them. And so what has been helpful is the support of a doula.
A doula is a woman experienced in childbirth who provides guidance and support to women before, during, and after childbirth. A bill was introduced in the Texas legislature to provide Medicaid reimbursement for doula services. We have information about other bills in consideration to improve maternal health on our mobile app.